Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about anion gap. What is anion gap? It measures acid-base balance of blood. So blood has positively charged electrolytes which is called cation and negatively charged electrolyte called anion. Cations are sodium, potassium, magnesium and calcium, whereas anions are chloride, bicarbonate, phosphate, sulfate, organic acid, etc. So anion gap measures the difference between these cations and anions. Anion gap is measured from a blood test from routine CMP, which is complete metabolic panel, or a basic metabolic panel. So to calculate anion gap, remember cation minus anion. If you look at the graph, in cations, sodium is the most abundant form of cation, or vast majority of the cation. So you take sodium minus anion, and in anion, chloride and bicarbonate are the most abundant forms. So chloride plus bicarbonate, which gives a value of 8 to 12 milliequivalent per liter. If potassium is added, then sodium plus potassium minus chloride plus bicarbonate, which gives a value of 12 to 16 milliequivalent per liter. So always refer to the lab values. Now, what is high anion gap means? High anion gap means acidosis. So any condition that causes acidosis can increase the anion gap, like diabetic ketoacidosis, buildup of ketones. That can lead to acidosis and high anion gap. Lactic acidosis, increased lactic acid, acidosis and high anion gap. Poisoning like salicylate, methanol, ethylene glycol, increased acid level acidosis that can lead to high anion gap. Kidney disease. In kidney disease, kidney is not able to excrete hydrogen ions or acid level that can lead to acidosis and high anion gap. Starvation ketosis, again increased ketones that can lead to acidosis and high anion gap. You will also see normal anion gap acidosis in dehydration and diarrhea. This is due to loss of bicarbonate. Now low anion gap needs more tests to rule out, but it is often due to low albumin. So albumin is the negative protein in blood, and decreased albumin lead to retention of negatively charged ion, chloride and bicarbonate, that leads to decreased anion gap. So today we learned about anion gap, and thanks for watching my video.